Good morning, viewers. My name is Alhaji Ilyas Onechojon, your anchor person on this program. Once again, I welcome you to the program, Folks Talk. And the topic on the discussion today is alcohol abuse. And my guest on the program is a special guest, Hajja Zainab Suleiman. She is a medical doctor, and that is the maximum I'll say. Hajja, you're welcome to the program.
Thank you very much, sir.
For the sake of our viewers, I understand from your profile that you are not just a medical doctor. You are a member of some international organizations and you represent some medical bodies across the world. Can you please tell the audience, the viewers, a little about your profile from the angle of the organizations that you are a member of?
Okay. My name is Dr. Zainab Suleiman. As he already said, I'm a medical doctor, at the same time human rights activist and also a political analyst. I'm currently representing and being elected as the African representative of Generation Democracy Network and also member of International Republic Institute, also representing the whole of Africa. I'm also the Vice President of Human Rights Watch and Youth Empowerment Foundation and also the head of Medical Rights, International Human Rights Protection Service. I think we'll just leave it there. I also run my own NGO, which is the Hope Foundation. I think it's been existing for the past 10 years now.
Thank you very much. I would have loved to ask more questions about that, but the program today is not specifically.
You can feel free to ask about that.
The program is not specifically about you per se, but we're going into that at the end of the program.
No problem.
We want to talk about alcohol abuse. Medically, what is alcohol abuse?
Okay, basically, alcohol abuse is when you have this excessive use of alcohol-containing products. It could be in form of soft drink, it could be in the form of soda, it could just be 100% ethanol, which is just 100% alcohol, which ranges from different percentage. If you know, alcohol is from 1% to even 80%. So depending on the percentage of ethanol concentration in it, that will determine the effects on the system and on the body. So the more concentrated it is, the more the side effects is going to be more toxic. So basically, when you have excessive use of something and you're addicted to it, it becomes an alcohol abuse.
Thank you. From the medical perspective, apart from it being excess, since it is a chemical and it is going into the system and an external chemical going into the system, what would you say is the medical effect of alcohol on the human body?
Okay, when you look at the medical effects of alcohol in the system, it means we are going to see how different organs in general is going to be affected once you intoxicate alcohol. The first target of alcohol once you intoxicate it, because it's your body itself has some certain percentage of alcohol in it.
Okay.
So when you take alcohol that is excessive, what will happen to the ammonia concentration in your body is the fact that it's going to deplete, or it's going to cause it to rapidly increase, which could actually shut down your liver or give you a liver problem. So the first target of alcohol, it goes to affect your central nervous system, of course, and then from your central nervous system, it affects other organ of your body. So your CNS, that's why initially when you just take alcohol, the first thing that you're just going to have problem with is you begin to feel very drowsy, dizzy, miscalculating, lack of coordination and all that, because it's going to depress the CNS, your central nervous system. So after a while, your whole system, of course, it goes to your blood, right? Your whole thing gets, put it in a layman words, the whole thing in your system begins to this is poison, this is too much for me to undo. But once it becomes an abuse, it means you can't even do without it. You take it over excessively and all that, not just because it's occasion or because of celebration, but because you choose to do
more or less like addiction.
More or less like an addiction. So you find you find people doing this because sometimes it could be a lot of factors. So basically in medicine, aside from the fact that it's going to affect your central nervous system, of course it will affect your liver. So when it affects your liver, what will happen is this. The liver basically is for it to like detoxify your system,
Okay.
right? So when you take alcohol and the function of the liver cannot do itself the way it should on a normal day, detoxify, filter this and all that.
Okay.
What will happen is this: the tissue in your livers begin to get damaged. When that happens, you're going to have individual begin to suffer from liver disease, liver cirrhosis. At the end of the day, the liver is damaged and is irreversible. So once your liver also is affected, you can actually have what we call hepatic encephalopathy. So that is actually because of the damage to the liver, it's going to affect your brain as well. So you have like not just affecting your CNS because of direct effects of the alcohol on your CNS, but from direct effects of the alcohol on your liver to your brain. So most times you see people that take excessive consumption of alcohol coming down with liver disease.
Okay. Definitely.
And not just that again, it could also result into thiamine deficiency, which is vitamin B1. What that actually does again is for it to like build your tissue, repair your tissue. So once you're taking excessive consumption of alcohol, it's going to affect that vitamin in particular. So you see, your brain needs to regenerate, your brain needs tissue, a good tissue repair to function, your skin, even your body. So at the end of the day, when you see an alcoholic person, it's obvious, you can tell from the way the skin looks, from the way the eyes look, from the way the tissue itself, everything just looks because it affects everything. So they usually suffer from thiamine deficiency, which is very essential for tissue repair.
Okay.
So likewise, women who also consume alcohol when they are pregnant, also it affects
the fetus.
Exactly. So you now see them coming out with baby that have small brain, baby that maybe because of during the course of pregnancy they are taking the alcohol. When they now give birth to the child, you see that even the child will now be having alcohol withdrawal syndrome.
I don't understand.
Okay, you see the baby will start shaking because it's already used to the alcohol. The baby will start having a lot of complications. Yes, because you are now separating the child from alcohol that is already used to, introducing the child into a new society.
What it implies is that even as the baby is in the womb,
yes,
the alcohol, he or she takes from the alcohol.
From the alcohol as well.
Okay. The good thing here is that you are not just a medical personnel, you are equally a researcher. Do you have an estimation of the figure of people that are involved in alcohol abuse across the world?
Okay, across the world, basically, in Nigeria, according to my findings, about 23 to 34 million people are into alcohol abuse. And young people across Nigeria comprises about 31 to about 43%. So these are young people who are depressed, people who are unemployed.
Depressed and unemployed.
Yes.
Okay. Given this figure, definitely it's going to have effect on the entire society. So what will you say is the social effect of alcohol on the society?
There is no benefit in alcohol because even when you look at the commercial adverts on media and all that, what you actually see is the celebration part. But alcohol has resulted into a lot of life destruction. Most especially, people don't always have limits. Things like alcohol that has an addictive element in it, definitely it's something that you always want to fall back to as a means of realization, as a means to hide from depression, as a means to hide from a problem. So it's more like I'm falling back to this thing. So what the social effect, there's no any benefits, like I said. But the social effect now is one, we have a lot of marriages that are broken because of alcohol consumption. We have people that have been sacked from work because of alcohol consumption. We have people who are on the streets because of alcohol consumption. We have people who are in debt because of alcohol consumption. We have people who have lost their life from accident because of alcohol consumption. We have people who just fell, collapse on the road because of alcohol intoxication. So I don't think there is any benefit from alcohol except destruction. So the social effect of alcohol is bad. We have people dropping out of school because of alcohol consumption. We have the high rate of STD, sexually transmitted disease, because of alcohol consumption. We have people who committed suicide because of alcohol consumption. So whatever takes you out of a place of sanity to insanity, it's dangerous to the society and it's harmful to the society. When you check people who are homeless today, majority of them are into drugs, majority of them are into alcohol.
Good. In the course of your analysis, you mentioned something that alcohol has some addictive content that makes people addicted to it. That means if one wants to withdraw from the addiction of alcohol, is there any medical means of withdrawal?
There is medical means
addictive habit.
Yes. In medicine, there's what we call community medicine, which actually deals with the level of prevention when dealing with alcohol, and it has step-by-step procedure which we do. The first thing that we actually do is when people approach us that they want to quit alcohol, we try to counsel them first, to tell them exactly what alcohol is and why it's, sometimes something is bad for you, but you don't know the mechanism behind why this thing is bad for your health and why it's also important
that you not even know the level
of damage. Yes. So in that case, what we'll do is that we introduce you, we lecture you about it, to tell you what alcohol is, we tell you the importance, why you have to leave the alcohol, we tell you the disadvantage of alcohol. You understand? After that, we then go to what we can do for you. The first approach is for you to already understand and come into conclusion that, I want to give up this thing. Because there is no amount of preaching or amount of lecture you want to give to someone that is not willing to change. So first is for you to acknowledge that this is an addiction, this is an abuse, this is something you want to do away with. Which of course is not an easy process, it's not an easy task. But we journey you through it. After we introduce you, we tell you, okay, this is how to go about it. We don't just take alcohol away from you, boom, at once.
Okay.
No, because you're going to cause a lot of damage to the person. You see, the person will start hallucinating, the person cannot stay, the body will be shaking, the person will even start misbehaving more. Yes, because can't concentrate. So we go step by step, precept by precept, to take away the alcohol.
Maybe
from you.
So
for example, if you are taking,
you are going to allow the person to take it.
Yes, we need to know the percentage of alcohol that you're taking. If the percentage of alcohol that you're taking is like maybe you're on 50% alcohol, for example, we will drop it from 50 to something like maybe 30. From 30 we'll go to 20. From 20 we'll go to 10. From 10 we'll go to 5. From 5 we'll go to 2. From 2 like that, that is how gradually we begin to withdraw. And alcohol and cigarettes, they are friends.
Okay.
They work hand in hand. You smoke cigar.
Most drunkards smoke, and most smokers drink. So
they are best friends. So we try to also tell you that you should avoid environment and people that will make you to go and smoke or drink. Yes, because once you drink, you smoke. So all those things, all those cigar things would ask you to take away. And if you are drinking, if you are smoking too, we have all those nicotine patch that will also give to you like a kind of chewing gum. It has nicotine, it has a little bit content of the nicotine effect in it. So we give you as a patch. You chew it, you understand. So gradually. Okay,
as a replacement for the
cigar. Yes, for the cigar. So likewise the alcohol too. So like that is how we withdraw people completely from alcohol. And then we create a support group, of course, and follow up. Where you come, we monitor your progress. There are a lot of people, once you withdraw cigar from them, they will die. Some people, once you withdraw alcohol from them, yes, they will die, like you just withdraw completely.
I don't understand.
Yes.
That if you stop them from drinking,
yes, they will just,
it's likely to kill them?
It's likely to kill them. So we don't rush a withdrawal from people who take drugs. We do it step by step, with patience, gradually. But sometimes, because of the society don't understand that this is an addiction, people can't do away with it. You know, it's more psychological, physiological, and even an emotional process, even for them as well. So you don't just come and like, you want to take away this thing one day, don't this. No, you kill the person. So we take it bit by bit, provide support group to encourage the person you are not alone. Introduce them to other change people too, that this person used to be a drug addict, this person used to take alcohol before, but look at his life after he changed. This is how his life is now. His life is now more better. He's living a decent life, and also if this person can do it, you can do it. So it's not a place for judgmental, this person is drinking. A lot of social factor in our society today is contributing why people drink. If there is no peace in the home, you marry into a wrong relationship, you are always depressed, you will run to alcohol. If you are not doing well, you are not financially stable, you need to take your mind off thinking. But that doesn't take away reality. So there are still better approach that we can use to tackle problems. If you drink alcohol tomorrow, the problem is still there. So it's only going to solve your problem just at that particular time. But after then, the problem remains. You are still who you are, and nothing is going to change. So peer pressure is also another factor that influences people. Once your friend is doing, you think, I'm still young, let me do it. But you are introducing yourself, introducing your system into something that you're going to regret later in the future.
Briefly, before we round up the program, there's an aspect that I have interest. Apart from the state of pregnancy,
yes,
does alcohol have another effect on women that
yes,
take alcohol?
Yes. Women that take alcohol, that in terms of alcohol abuse, definitely won't keep home. And secondly, for the child, even the woman's body system over time, because of the way the physiology of a woman is, they fall into mental health issues so easily, and into depression, self-harm, and suicide very easily. And most times you see many of them will run away from home, no matter what you give to them. Such women end up contacting different kinds of diseases, because at the point of intoxication, they end up having unprotected sex without even remembering who they are. And in terms of paternity fraud too, research shows that most women that are alcoholic don't even know the father of
their children. Wow.
Because at the peak of anybody you see, you just want to do and all that. So it causes disbalance and a very dysfunctional society. Even you modeling your kids too is going to be a very toxic environment, even for the child as well to grow.
Finally, I want you to conclude on this matter.
Yes.
You have some few minutes to run a summary of all that we've talked about on alcohol abuse, the population of people that are involved, the medical effects, and the procedure to withdrawing.
Okay.
So I'll make a recap of the entire discussion.
So a recap for it all: alcohol is not celebration, but rather destruction. So when you want to take alcohol, you need to think of the negative effects. And the fact that you're alcoholic, that doesn't mean that you can't stop it. There are medical provisions, there are support groups that you can join. You can even write me on Facebook, or you can have my contacts and write me directly. If you truly want to journey towards alcohol withdrawal, I could help you journey towards the process. Likewise, cigarette smoking. So we can all journey together if genuinely you want to quit alcohol. So it's not something that you can't do without. It's an addiction that you can be free. It's an addiction that the society is aware, and we have different rehabilitation and recreational centers that can actually help in order for you to deal with your addiction and quit alcohol abuse. And this is also a medium for us to, as a social worker, community health workers, and also as health educators, to actually create more awareness about the effects and the damage of alcohol abuse in our society.
Thank you very much. We are going to find time again to discuss some other social effects that have to do with medical, that we need medical advice on them, like apart from alcohol, there are several other drugs that people abuse, especially among our teenagers and that age bracket. It has even gotten to a point that they abuse substances that are not known to, that are not meant for human consumption and all of that. It's an aspect that we are going to seek your time again to talk about. There is another angle altogether again about men recently. A lot of them, I'm not a medical person, but I know from my common sense that the use of enhancers these days by men, manpower,
causes heart attack.
It's another aspect that there are several other medical issues, but my fear is your timing because I know you are engaged both local and internationally and come to talk about your own personal commitment. But for the sake of humanity and the society that you are seeking to protect, we'll appreciate more if you're going to have time to be here with us.
No problem.
But this one that you are here today, we appreciate you and we thank you for being here for your people. Thank you. You're welcome. Viewers, this is the much you can take on the program today. My guest on the program is Zainab Suleiman, a medical doctor and a researcher, human rights activist, a political analyst, and all of that. This program is Folk Talks, and my name is Alhaji Liasone John, your anchor person on the program. See you again sometime next week, and thank you for being with us.
Mete nebi na balyo memele me wakalo tubo ibo. You are TV, you are TV. Menawa, you are TV. Menawa kalo ina bali ogeta. Iyo buba eyola ukola etete. Menawa kalo tubo ibo. You are TV, menawa, you are TV. Ibo migala, you are TV. Menawa, you are TV. You are TV. Ibo migala, eduni medododa. Menawa, you are TV. Adukola pogo, ukole kiwanugo. Ekumene jumeli, bakumene timebo. Menawa kalo tubo, you are TV. Selemabo igala, nebukolo jamalia. Ukole iogu, mayuche iogu. You are TV. Amadukole yopogo.